As we grow older, our bodies often send quiet signals before something serious develops. The challenge is that many of these signals don't feel dramatic. They feel ordinary, easy to ignore, and that's exactly why doctors emphasize awareness rather than fear. Heart attacks rarely happen without warning. In many cases, subtle symptoms can appear weeks or even months before a serious heart event, especially in adults over 60. Recognizing these signs early doesn't mean panic. It means protection. According to the American Heart Association, approximately 128 million U.S. adults, or about half of U.S. population, had some form of cardiovascular disease, and age is one of the strongest risk factors. Medical professionals emphasize that no single symptom can predict a heart attack. However, there are certain physical sensations that doctors commonly include in conversations about heart health, particularly with older adults. Recognizing these sensations does not mean something serious is happening. It simply helps people make informed decisions and communicate clearly with their doctors. In this video, we'll walk through 10 common symptoms that healthcare providers often ask adults over 60 about during heart-related checkups. These symptoms are not diagnoses, and many people experience them without having heart disease. One of the most commonly overlooked symptoms is discussed at the end of this video, along with doctor-recommended habits that support heart health. Staying until the end can help you better understand what to pay attention to. The information in this video is based on reviews of many scientific research and medical publications, with source links provided in the description below. Let us know your age and the general health topics you'd like us to cover in future videos. This content is for general educational purposes only. It does not replace personalized medical advice. Let's start with a symptom that many people don't associate with the heart at all. What makes heart-related symptoms especially confusing is that they rarely announce themselves clearly. Some feel subtle, some feel familiar, and many are mistaken for everyday discomforts, especially after 60, persistent or unusual fatigue. Fatigue is one of the most commonly reported concerns among older adults, and in most cases, it has nothing to do with the heart. Poor sleep, stress, medications, and normal aging can all contribute. However, cardiology references such as Harvard Health Publishing and Johns Hopkins Medicine explain that healthcare providers become more attentive when fatigue appears suddenly, persists despite adequate rest, or starts to interfere with normal daily activities. From a physiological standpoint, the heart's job is to supply oxygen-rich blood to the body. If circulation becomes less efficient, muscles and organs may receive slightly less oxygen, which can contribute to a feeling of low energy or heaviness. This does not mean a heart condition is present, but it helps doctors decide whether further evaluation is appropriate. Changes in sleep or difficulty sleeping. Many adults over 60 experience changes in sleep patterns. That alone is not unusual. What healthcare professionals ask about is new or worsening difficulty sleeping, especially when combined with daytime fatigue. According to WebMD and the National Heart, Lung, and Blood Institute, poor sleep can influence blood pressure, stress hormones, and inflammation, all factors involved in cardiovascular health. Doctors may ask if you have trouble falling asleep or staying asleep. They may also ask if you wake up often during the night, or if you still feel tired and unrefreshed in the morning. Importantly, sleep issues can both affect and be affected by overall health. Addressing sleep quality is often part of a broader approach to maintaining heart wellness. Shortness of breath. Shortness of breath can occur for many reasons, including lung conditions, allergies, or lack of physical conditioning. However, doctors often ask about it because the heart and lungs work as a team. When the heart doesn't pump as efficiently, fluid balance and oxygen delivery can change, making breathing feel more difficult, particularly during activity or when lying flat. According to Medline Plus, healthcare providers become more attentive to shortness of breath when it is new or gradually worsening, when it happens during mild physical activity, or when it occurs along with fatigue or chest discomfort. Again, this symptom alone does not indicate a serious condition, but when discussed openly, it helps clinicians build a clearer picture of overall cardiovascular health. As people age, the body often communicates in quieter ways, and some of the signals doctors listen for are not where most people expect them to be. Digestive discomfort, nausea, or bloating. Stomach discomfort is one of the most misleading symptoms on this list. According to WebMD and Cleveland Clinic, nausea, indigestion, or a bloated feeling can come from many non-cardiac causes, such as diet, acid reflux, medications, or stress. However, doctors sometimes ask older adults about digestive discomfort because the heart and digestive system share nerve pathways. In some people, physical stress or reduced circulation may be felt as upper abdominal discomfort rather than chest pressure. Healthcare providers pay closer attention when this discomfort appears without a clear digestive cause, returns again and again, and happens alongside fatigue or shortness of breath. Again, this does not indicate a heart condition, but mentioning it helps doctors rule things out appropriately. Cold sweats or lightheadedness. Occasional cold sweating, feeling lightheaded, or brief dizziness can happen for many reasons, including dehydration, low blood sugar, anxiety, or standing up too quickly. What surprises many people is medical references such as Medline Plus and Cleveland Clinic note that these sensations are sometimes discussed in the context of heart health, especially when they occur unexpectedly or repeatedly. This happens when the nervous system reacts to reduced blood flow. Many people describe waking up drenched in sweat without feeling overheated. Cold sweats are typically described as clammy or sudden sweating that doesn't seem related to heat or physical activity. In some individuals, this may occur alongside nausea or a faint feeling. Healthcare providers may ask about these experiences because they can sometimes relate to temporary changes in circulation or blood pressure, which become more common with age. It's important to understand that experiencing cold sweats does not mean a heart problem is present. Many people have this symptom for reasons unrelated to the heart. Still, doctors encourage older adults to mention unexplained or recurring episodes during routine checkups so they can be evaluated in the proper context. Jaw, neck, shoulder, or upper back discomfort. Pain or discomfort in the jaw, neck, shoulders, or upper back is often blamed on posture, arthritis, or muscle strain, especially in older adults. And in most cases, that's exactly what it is. Still, cardiology references such as the American Heart Association explain that the nervous system can sometimes interpret heart-related strain as discomfort in areas away from the chest. This is known as referred pain. Doctors tend to pay closer attention when this discomfort feels unusual or unexplained, when it happens during physical activity, or when it appears together with fatigue or shortness of breath. When these subtle sensations are viewed together, doctors may also ask about more familiar experiences, not because they are dangerous on their own, but because patterns matter. Chest discomfort or pressure. Chest discomfort is one of the most widely recognized heart-related symptoms, but it's also one of the most misunderstood. According to the American Heart Association and Cleveland Clinic, chest-related sensations linked to heart strain are often described as pressure, tightness, fullness, or heaviness, rather than sharp pain. Some people compare it to something sitting on the chest. What makes this symptom tricky is that many non-heart conditions can feel similar, including acid reflux, muscle strain, anxiety, or gas. That's why doctors focus less on pain alone and more on patterns, such as discomfort that shows up during activity or stress, sensations that improve with rest, and pressure that feels different from ordinary indigestion. As blood vessels age, they can become less flexible, which may temporarily reduce blood flow during exertion. This is one reason healthcare providers often ask older adults detailed questions about chest sensations, even when they seem mild. Unusual weakness or sudden fatigue. Feeling tired from time to time is normal, but doctors take note when someone reports sudden or unexplained weakness, especially if it feels different from typical aging-related fatigue. Medical literature explains that the heart works continuously to deliver oxygen-rich blood to muscles and organs. If circulation becomes less efficient, even temporarily, the body may respond with generalized weakness, shakiness, or a drained feeling. According to Johns Hopkins Medicine, this type of fatigue may be noticed during everyday activities that previously felt easy, such as walking short distances or doing light household tasks. Importantly, this does not mean the heart is failing. It simply helps doctors understand whether circulation and oxygen delivery are meeting the body's needs. Swelling in the feet, ankles, or legs. Mild swelling in the lower legs is very common with aging, prolonged sitting, or warm weather. However, medical professionals often ask about persistent or worsening swelling because circulation plays a role in fluid balance. According to Mayo Clinic, when the heart's pumping efficiency changes, fluid can sometimes accumulate in the lower extremities. This symptom alone is not diagnostic, but it can help doctors assess circulation and overall cardiovascular function. Flu-like feelings without a clear cause. Occasionally, people report mild flu-like sensations, such as body aches, low energy, or general discomfort, without having a fever or infection. While this is usually related to viruses, inflammation, or stress, medical references note that systemic inflammation can sometimes accompany cardiovascular strain. Healthcare providers don't look at this symptom by itself. They consider how long it has been happening, whether it keeps coming back, and if it occurs together with other symptoms. In older adults, persistent unexplained discomfort is something doctors may choose to discuss further, simply to rule out underlying contributors. Let's summarize all these 10 points. Doctors often encourage old adults over 60 to notice changes which are unusual fatigue, sleep problems, breathing changes, chest discomfort, dizziness, unexplained sweating, digestive issues, pain spreading to the jaw or arm, swelling in the lower body, and any overall changes that feel different from normal. Being aware of these signs helps you monitor your health and discuss concerns clearly with your doctor. If you've recognized yourself in one or more of the symptoms discussed in this video, take a slow breath. That is very common. Most adults over 60 experience changes in energy, sleep, digestion, or circulation at some point. In fact, many of the sensations we've talked about are part of normal aging or everyday health fluctuations, not signs of a serious condition. Doctor always recommends some habits that support heart health, which are: stay gently active. Regular movement such as walking, light stretching, or household activity helps support circulation. Maintain consistent sleep. Good sleep supports blood pressure regulation, hormone balance, and energy levels. Pay attention to stress. Chronic stress can affect heart health over time. Simple practices such as deep breathing, quiet breaks, or spending time outdoors are commonly encouraged by healthcare providers. Don't ignore new symptoms. Many doctors say the most important question isn't, "Is this serious?" but, "Is this new for me?" New or unusual sensations are always worth mentioning during routine checkups. Follow medical guidance. If you've been prescribed medications or given specific recommendations by your healthcare provider, consistency matters. Always discuss changes or concerns directly with them. If you found this video helpful, you may also enjoy our other videos that focus on healthy aging habits, better sleep and energy after 60, and simple ways to support circulation and mobility as we age. And if you're comfortable sharing, you can leave a comment about which topic you'd like us to cover next. Your experiences often help others feel less alone. Thank you for spending this time with us. Take care of yourself, and we'll see you in the next video.